The lateral cord of the brachial plexus gives off the lateral pectoral nerve, which primarily innervates pectoralis major. Injury to this nerve would result in atrophy and weakness of pectoralis major. The posterior cord gives off the upper subscapular nerve, the thoracodorsal nerve, and the lower subscapular nerve. The upper subscapular nerve supplies the superior portion of the subscapularis muscle, the thoracodorsal nerve supplies latissimus dorsi, and the lower subscapular nerve supplies the inferior portion of the subscapularis muscle as well as teres major. Injury to any of these nerves would result in difficulty medially rotating and adducting the shoulder. The medial cord gives off the medial pectoral nerve, the medial cutaneous nerve of the arm, and the medial cutaneous nerve of the forearm. The medial pectoral nerve supplies the pec minor as well as the sternocostal part of pec major. Injury to this nerve would result in difficulty adducting and medially rotating the shoulder, as well as difficulty drawing the scapula anteriorly and inferiorly. The medial cutaneous nerve of the arm and the medial cutaneous nerve of the forearm provide sensory innervation to the medial aspect of the arm and forearm respectively. Injury to these nerves would result in altered sensation in those areas. Terminal branches. The musculocutaneous nerve provides motor innervation to the anterior compartment of the arm as well as sensory innervation to the skin of the lateral aspect of the forearm. Injury to this nerve would result in weak arm flexion as well as sensory loss along the lateral aspect of the forearm. The median nerve innervates the muscles of the anterior forearm as well as the muscles and skin of the lateral palm. Injury to the median nerve would result in paralysis to the muscles of the anterior forearm and palm as well as paresthesia to the skin of the lateral aspect of the palm. The ulnar nerve innervates flexor carpi ulnaris, flexor digitorum profundus, and the intrinsic muscles of the hand. Injury to this nerve would impair wrist and hand flexion as well as sensation to the medial hand. The radial nerve provides motor innervation to the muscles of the posterior compartments of the arm and forearm, as well as sensory innervation to the posterior arm, forearm, and hand. Injury to this nerve would result in difficulty extending at the elbow and wrist, as well as paresthesia to the aforementioned areas. Finally, the axillary nerve provides motor innervation to the teres minor and deltoid, as well as cutaneous innervation to the lateral arm. Injury to this nerve would result in impaired shoulder rotation as well as paresthesia to the lateral arm.